Now, dear student, today we are going to study uh, third unit, last chapter of third unit, that is educational and training program in a hospital. This training program is usually conducted in a hospital in entire throughout the year uh, in different topics or different subjects. That sometimes they conduct by the experts, or sometimes they experts within the hospital. They are coming within the hospital, or sometimes they hire the experts or agency outside from the hospital, and they gives the training to our staff, uh, physicians, doctors, pharmacist staff, or nursing staff, or pathologists, or compounders, or different personals who are working in a hospitals. They are attending different kind of training session in this um, in their schedule, and they have to attend that training once in a year or twice in a year as per their curriculum or as per their need. These kind of training session must be conducted in a hospital throughout the year for the all kind of personals they are involved in a hospital. So mm, we can see in the slide. Now outlines, majorly it is based on the training program, informative abstract, introduction, proposed training, conclusion, reference, appendix, etc. is there, but main concentration on the training program for the hospital personals working in a hospital. Now, informative object to provide a complete training and the orientation program for the hospital. We need to develop the fleet of trained professional to deliver high standard of quality training and the orientation services to satisfy, exceed the organizational requirement for the providing better services to the all patient. What is the main of that? Main aim is to provide better health services to the patient, or better health services to the your customer, you can say. If hospital is there, then patients are your customer, or patients are your um, target to give or to provide a better health services to them. So you have to take care of this patient by giving the better and better services to them. And how they will get services? They will get services by the staff working in a hospital, and staff, if staff is well trained, then they will give better facility to the patient. So, Ashish, uh, take the picture of attendance.
Yes, sir.
Some students, more students are coming.
Yes, sir.
Now, project or this training purpose, corporate training center in a hospital, solving the problems and developing the hospital staff work, providing complete range of training and orientation course to facilitate the better services to the hospital or in the hospital, or they provide the better services to the patient. Now, what is the main target? To winning the customer confidence or satisfaction. That is our aim or object, means to give better and better services to the patient, to get fully satisfied from the from our hospital. That is our mission, objectives, and goal. We provide the training courses or training courses conducted in the hospital: health administration course, public speaking and communication management course, medical orientation course, information technology upgradation course, and also course for the physician and doctors. They also included in this. Need, why it is needed? By giving the high customer satisfaction to the customer will result increase the profitability and income. Here we are not talking about the government hospital. They are running in a zero profit, zero loss, or they are running on a charitable basis. So our main aim is to give the satisfaction to the your patient. That is the main goal. Good hospital reputation will be attract the patient. That is the aim in private hospital, to attract the patient or to give the better and better services to the patient. Now, this training course objective to enhance the medical services. The training course objectives is to enhance medical services standards and bring a smile to the patient face. Uh, Means you have to fulfill the requirement, or you have to fulfill the desire of patient, or give the proper service to the patient. That is your main goal. And for that reason you need trained and professional workers or employees. They will take care of the patient services and patient requirement all the times. So this is a uh, any training agency or any company who is giving the training session in a hospital. What is their aim? The professional and qualified teaching staff for the all education need. um, all training should be provided to the personals by the trained staff. uh, Commitment to provide, organize, and conclude the successful training programs, follow-up programs, and continue education program. Like that, you have to develop this kind of services in your hospital or hospital. Any hospital they are running in a city or in a town, so they must conduct this type of training programs throughout the year, entire year. They can hire the agency, or they can arrange different speakers for the training session, but they have to conduct this type of training programs for the benefit of their staff as well as for the patient. uh, Successful training program in the world, such as some agencies or some hospitals, they are a pioneer to start this type of programs. This Florida hospital career program, they have maintained their curriculum for the training session of hospital staff, nursing staff, physician. This type of curriculum they have made, and some agencies they are following their curriculum in a different hospitals. Some name is given here: Florida Hospital Career Program, Sanford Brown Training Program, University of Phoenix, and other universities or other medical hospital medical institution. They are running their training programs throughout the year. Limitation during the executing phase of the project or this training purpose, we expect the phase of some limitation. Some financial limitation is there, management limitation, high cost, or schedule of shortage, or schedule shortage of timing. These limitation we have to uh, face when we conduct the training program, because the patients is continuously coming in a hospital, or hospitals in the country like developing country like India, they are having um, throughout a year lot of patient coming in a hospital. So it is very difficult to conduct this type of training program entire year, but we have to make a programs to educate our employee. So in between we have to arrange speakers, we have to arrange these training programs, training schedules for the our employee or our workers who are working in a hospital. Some limitations are there, then also we have to conduct these kind of programs. What are the scopes? These special customs built training programs for the medical and administrative staff. They enhance their skills in these training programs. The trainees are attached to a mentor in a clinical and administrative department at a hospital premises. Uh, this our these agencies are going to provide a complete package for the training program to the all employees working in a different level. So if you are hiring some agency for the training program, or some agencies who are that is giving the training in a hospital, they are giving training to all level of employees. So physician, medical staff, pharmacist, nursing staff, um, class 3, class 4, clerical staff or administrative staff, admin staff, they are giving all kind of training in a different time, different schedule. So training program are generally ranges from 45 to 90 days in a year. So propose plan or objective proposal, what type of training and when this training is going to conduct, or this some objective and methods given in this flow chart. You write down this. uh, Getting hospital in-house training program approval after the gathering and organizing training material and tools, conducting the course, deputing uh, deputing the course coordinator depends on the courses. Means you have to hire, or you have to call, or you have to bring the speakers which is relevant to that particular session or that particular audience. If audience are physician, then you have to call that particular uh, type of expert you needed. Understand the training requirements. uh, Customizing the training program, getting approval with hospital management about the course content, conducting the course, conduct the examination, and issuing the completion course certificate to the trainees they are attending the programs. So this kind of educational and training program continuous going on in a hospital throughout the year for the different level of employees. Dr. Nilesh Jains are also with us. uh, we have today World Pharmacist Day, and you must join on time that program. I am winding up my session now. Now, timetable of the training schedule is analyzing the idea and waiting for the approval of license, designing the starting, that is for manufacturing of for the completion of any uh, new hospital, and uh, preparing the new hospital, and the conducting the all type of courses within a hospital, like that schedule is given here. That is not that much important. Now this material and equipments that needed for the programs or the training programs and educational programs, and the high speed internet facility practicing the simulation software, the transport facility, projector and laptop, training manuals, display board, marker, pencil, like that, all equipments which needed in any training institute that you have to require. Uh, Facility, existing hospital training room facility must be there, some cafeteria facility for long teaching session or entire day session or 2 day or 3 day training program, then you have to this kind of facility also must be there. Building infrastructure like electricity, water, projector, parking facility, separate classes for ladies training session, that also if required you have to make available for them. Needed facility, we require 500 square feet area to set up training program classes in a hospital, complete training session, equipments like projector, laptop, high speed internet, computers, etc. we needed for that training program. Spacious two halls with separate, that is not required nowadays, separate ladies teaching and employees, they can take a training together also, male and female. Transportation facility for student and employees, and nearby the cafeteria or our located building. This is a cost or financial budget which required in a training and educational program. This is also assets and case and transport facility expenses for the same. Now feasibility, we are starting the in-house training program services that focus on to conduct the course in a hospital premises to educate or to train our workers or employees or staff who is working in a hospital. And this price, it should be a very reasonable price and can be altered, but quality levels cannot be compromised, so that programs not that much to uh, expensive to change or to affect the budget of the hospital, but it should be a quality program to improve the skills of our employees or our workers. The unique opportunity to flourish, to conduct the class in the hospital for upgrading the skill set of the employees in the area of health administration courses, frontline management services courses, public speaking and communication
Sengar
management.
sir, sorry to interrupt you.
uh, no problem, yeah.
Sengar sir, sorry.
बस लास्ट
Sengar sir,
जी प्लीज.
Sengar sir. हाँ नहीं नहीं सर, बस आप जब